Hello students, we will discuss a case which is again very commonly seen and we will come across in surgical OP, ENT OP and onco OP. See this, what this condition is. Look at this, oral cavity, there is a lesion here. See that tongue, irregularity is there, some area redness, some area slough is there, stiffness is there. See that, what is this condition is? It is ankyloglossia due to carcinoma tongue. So especially when malignancy occurs in the tongue, when it spreads, you know that lateral margin is the commonest site and eventually it goes deep as infiltration locally and involves genioglossus, and genioglossus unable to contract because of the infiltration act properly, so they won't be able to put the tongue out. All of you know that there are extrinsic muscles and intrinsic muscles. Like genioglossus is extrinsic, like intrinsic muscles are which alters the shape of the tongue during speech and swallowing. So extrinsic muscle, one of the extrinsic muscles, genioglossus, get infiltrated with the main muscle of the tongue actually, causes ankyloglossia of the tongue. So what are the features? Inability to protrude the tongue as the tongue gets fixed due to infiltration or fibrosis of genioglossus muscle. That is the one. So seen in carcinoma tongue with local infiltration and after radiotherapy. So common cause is carcinoma tongue with the infiltration that is locally advanced actually considered. And also for oral malignancy, one of the therapeutic modality is radiotherapy. So after radiotherapy, extensive fibrosis occurs and tongue may not be able to protrude forward. So that will lead into the ankyloglossia as a post-radiotherapy fibrosis. So that is the ankyloglossia. So any malignant oral cavity malignancy, in specific tongue carcinoma, you have to always look for, ask the patient to move like this. If they won't be able to protrude outside, then it is called as ankyloglossia. It has got its own clinical value. And also patient was undergone radiotherapy, especially for oral malignancy, they won't be able to put the tongue out. Then also it is important, that is called as ankyloglossia. So please go through my clinical methods in surgery, which shows videos and examination properly in detail with the differential diagnosis, and also my manual of surgery, current edition in detail as per CBME syllabus. It is shown, it is given all chapters, urology, specialties, cardiothoracic and so on, as far as UG CBME, very useful for PGs also. My operative surgery extensively discussed volume 1 and 2 about all procedures in detail, major, minor, everything with the proper illustrations and photos. Of course, my DigiNote through JP Publishers gives extensive lectures. I've covered everything about A to Z clinical examination, each chapter's topics and specialties including instruments, specimens and X-rays, images and so on. So students, I hope you have understood this simple topic but very important, that is ankyloglossia. Thank you very much.